Okay, so now we will be looking at appendicitis. First of all, we will look at the definition of appendicitis. Appendicitis is acute inflammation of a vermiform appendix. Now look at the normal anatomy of intestine. This is large intestine. Now appendix is present here. This is normal appendix, and when inflammation occurs, this is inflamed appendix, and inflammation of appendix is known as appendicitis. When appendix is inflamed, that condition is known as appendicitis. So the causes of appendicitis are emergency abdominal surgery. Most commonly occurs in emergency abdominal surgeries. Infections can also cause appendicitis. Obstruction of fecal matter, which is known as fecolith. Fecolith can cause appendicitis. Lymphoid hyperplasia can also cause appendicitis. When lymph nodes are inflamed or increased in size, hyperplasia of lymph node occurs, then appendicitis occurs. Inflammation and fibrosis of colon can also lead to appendicitis. So now we will be looking at the signs and symptoms of appendicitis. Signs and symptoms will be acute abdominal pain. Patient will complain abdominal pain for 6 to 12 hours in right lower quadrant area of the abdomen. Patient will complain of pain in right lower quadrant. Now let's suppose this is abdomen. We will divide abdomen into 4 quadrants. This is right side and this is left side. So this is right upper quadrant, this is left upper quadrant, and this one is right lower quadrant, also known as right hypochondrium. So patient will complain of pain here in this right lower quadrant, and the patient will have anorexia and pain most commonly at McBurney's point. McBurney's point is located halfway between umbilicus and anterior superior iliac spine. Now this is McBurney's point, and patient will complain of pain at McBurney's point. So this sign is known as pointing sign. Patient will point the location of pain. So this sign is known as pointing sign. Pain is present at McBurney's point, and nausea, vomiting will be there in the patient. Patient will have fever, which will be 101 Fahrenheit, and rosing sign will be there in the patient. Now rosing sign is palpation of left lower quadrant, which is paradoxically causing pain in right lower quadrant. Now we will put the finger here from the left side, and patient will complain the pain felt by patient on the right side. So this is known as rosing sign. Patient will have constipation, abdominal distension, local tenderness with pressure. Whenever we will touch the patient here in this right lower quadrant, he will complain of pain. So these are the signs of the patient. Patient will have fever, patient will have pain, rosing sign, pointing sign, and tenderness over this area. So these are the clinical signs for appendicitis. Now pathophysiology for appendicitis: due to infection, fecal stone or obstruction, patient will complain pain because of obstructed lumen of appendix, and it will increase intraluminal pressure, and it will disturb blood supply, and edema, swelling of the appendix occur, and then in the end stage rupture of appendix occurs, and that is very emergency alarming situation. Okay, so now we will be looking at diagnostic evaluation and laboratorical investigation for appendicitis. We will perform blood studies, and those blood studies shows WBC will be increased because this is inflammation. So inflammation shows increase in WBC, and in acute inflammation, during inflammation WBC increases. Now inflammation is of two types, one is acute and another is chronic inflammation. During acute inflammation, predominant cell which increase are neutrophils. Neutrophils increase, and during chronic inflammation macrophages increases. So these are the indications for inflammation. And then urine lysis will be performed. Laparoscopy is performed for diagnostic evaluation, and by positive signs and symptoms we will also perform certain tests. So complications for appendicitis will be perforation, abscess, and then peritonitis can develop after appendicitis. Medical management will be antibiotics should be administered, IV fluids should be given to the patient, and surgery is performed in emergency. Then we will give analgesics to the patient to relieve the pain. Ice bag therapy should be performed and comfort the patient. Surgical management will be appendectomy should be performed. Appendectomy is removal of appendix, and we will perform appendectomy. So in this way we can treat the patient of appendicitis.